With Professor Jason Leitch. He's the National Clinical Director for the Scottish Government and joins us now from Glasgow this morning. Delighted to see you. Thank you very much for your time.
Morning.
Can I just ask, first of all, in terms of where we are at the moment and how the UK is faring, you see a lot on social media about these sort of tracking graphs and how far the UK is behind Italy at the moment. We may be only 9 or 10 days behind them, but rates of infection may be worse in this country. And it's hard to know how much of that is accurate. What can you tell us about that?
It's not entirely accurate. You have to bear in mind that every country is different, but the virus isn't. So the virus is the same. And the virus is affecting people similarly in Wuhan province, in Korea, in Italy, and here. What's different is the timing and the nature of the demographic of the country and the health system of the country. So every health system looks a little bit different. So Japan, for instance, has a lot more small hospitals than big hospitals. We have quite a lot of big hospitals across the United Kingdom. So you would expect us to change the way we do it depending on what we have available to us. So that's what you're seeing. And in Scotland, for example, we have Shetland. Shetland and Orkney look a little bit different from the centre of London. So we've got to adapt, but it is still a very, very difficult virus,
yeah,
and is going to be tricky.
But there is an opportunity then, if we observe these social distancing measures very strictly, to stop following the kind of path that Italy has been following.
Everything we're doing is learning from other countries, both the things that have gone well and the things that haven't appeared to go quite so well. So we're in touch with our Chinese colleagues. Some of my guys had a call yesterday with the team in Wuhan, some of the people in Wuhan who have been working on this crisis. You can be certain that the United Kingdom is learning as a 4-country collective from all of these countries who are working on this. And what we've learned is that social distancing is completely crucial. Crucial to protect you and I, but more importantly, to protect our elderly parents or those with pre-existing disease, to try and help them get through this really difficult few months.
Well, let's really try and understand social distancing very clearly then, because it is different to self-isolation. What is the simplest way you would explain it to our audience?
So it's breakfast time, Rachel, so I'm really sorry, but we're going to have to get a little bit horrid.
Okay.
So if you think about the chain of the virus, if I have the virus, I shed it. I shed the virus in my saliva and when I blow my nose. So that virus is then a risk to other people. So if I am symptomatic and I'm coughing and perhaps blow my nose a little bit and all of that, so that will go either onto you if you and I were in close proximity, or it will go onto surfaces that other people can then touch and take into themselves. You cannot get it through your skin. You can only get it if you ingest it in some way. So eyes, noses and mouths. So I'm sorry everybody's having their scrambled eggs, but it's really important. And what we're trying to do is break the chain of that virus. So keep the symptomatic people at home. That breaks the chain. Wash down your surfaces. That breaks the chain. Wash your hands. That breaks the chain. And keep 2 meters apart as much as you possibly can. Not with your 18-month-old toddler. I mean, that's ridiculous. But keep 2 meters apart as much as you can from your mum today on Mother's Day, or stay away and use video conferencing. That breaks the chain.
But we had this situation yesterday then where everyone was thinking, OK, let's get out in the fresh air. We can't go to the pub, we can't go to cafes. Let's get out to the fresh air. So then those kind of big parks became huge points of congregation, didn't they? So this is another problem then.
So that's a challenge. Those of you who have seen the Australian Prime Minister in Bondi Beach yesterday, when thousands of people went for the last time to Bondi Beach before it got closed. So we have to use common sense. So my mum and dad are both 79 years old. They've been walking every day. They've either done that from home or they've driven locally to a countryside area and they've walked. They've kept their distance from other people and it's worked really well. In fact, I think they've probably walked more since they've been socially distancing than before they socially distanced, to be honest, which is great. But so we've got to be sensible. No team games, no five-a-side football, but football across a fence in the back garden, that's acceptable.
Get creative in that case. So can we fly through some questions from our viewers then, if that's okay?
Of course.
So I'll address this one first, because I think you've probably already answered it. I live in a rural area. Is it safe to go for a walk outside where I'm unlikely to meet anyone?
It's not only safe, it is recommended.
OK, great. Another one here. I live alone with nobody to assist. Several years ago, underwent bypass surgery. Should I be locking myself away for 12 weeks? Now, this is the sort of particularly vulnerable category that I know the government now wants to completely self-isolate for a period of time. Can you tell us more about that?
So it's really difficult to give individual advice. So I've got to be slightly careful. But from what you've said, that person is not immunocompromised. A heart bypass doesn't make you immunocompromised. So they're not in the super high-risk group, like those who have chemotherapy or have organ transplants. They're in the next group down, who should take social distancing very, very seriously. So if they can get somebody to get their shopping, if they can avoid public transport, work from home, that would be better. If they have to go out to get their shopping, then they should do that, taking those sensible social distancing measures into account. OK. And this one is an interesting one. No one has discussed holiday actually within the UK, travel within the UK. Should we still go if already booked? We're a little bit worried, particularly in Scotland. There was quite a lot of reports yesterday about people kind of escaping to their holiday homes in the Highlands. And remember, our health services and our food infrastructure and everything else is geared up for what normally happens. So we're ready for some people to go for the Easter holidays. We're not ready for people to arrive in the Highlands and Islands and use the health service for the next 3 months. So we need to be slightly cautious. So I think if you've got a holiday booked and you can continue to do the social distancing, you can go to your caravan on the coast, I think that's probably okay. But what we don't want is hordes of camper vans coming to Fort William, because the health service will not be able to manage that, because some of those people will get sick. Yeah. We're not taking this lightly. This is properly serious, this virus.
And that applies to any of those holiday destinations, as you say, wherever in the United Kingdom. Another one. Correct.
Here. Not just the random Scottish one I picked out by here.
It's a very beautiful part of the world, but of course. This one here, I'm a Scottish nurse. I've got a 1-year-old and a 14-year-old. How do I keep my family safe when I come home after a shift? I'm scared.
So the first thing to say to her is that we're very grateful for her, and we need her healthy, we need her well, we need her to be able to buy shopping. So please, will people stop buying too much, because she will have a 12-hour shift and she'll have 20 minutes on the way home before she goes to see those kids to pick up some groceries, and she needs them. So really, it's selfish to buy too much. I cannot emphasize it enough. However, she's also very well trained in cross-infection and how to look after stuff. So the change is that probably she shouldn't hug those kids as soon as she arrives. She should immediately wash her hands. She won't be wearing her uniform anyway, because uniforms are not worn outside the hospitals. So she is perfectly able in that household, as long as everybody is asymptomatic, to treat those kids as normal. So she can hug the 1-year-old before they go to sleep.
Ah, well, that is a relief to know, I know. And in terms of how we're looking after our health staff at the moment, officially, we're told by the managers there aren't any issues with personal protection equipment. But what we're hearing from the front line is accounts of people saying there really isn't enough of it. There's not enough to go round. There isn't time to fit it properly to everyone. Certain parts of the country are running out. What can you tell us?
So I can tell you there's 3 big challenges here. And remember, we've been planning this for a long time, but it is on us really fast. So we need supply, we need distribution, and then we need actual fit of the individuals. So I know there is enough supply. The distribution has been challenging because we're adding in new places. So we're adding in care homes, we're adding in community pharmacies. We've not had to do regular PPE transmission to those places before. So that's causing some individual challenges around the 4 UK countries. And then the third thing is we have to train, particularly the high-end people, the intensive care nurses and those we're training up to help us in intensive care, to know how to work these masks. The high-end masks, which not everybody needs, are uncomfortable. They're not a pleasant thing to wear. I've worn them in theatre, and they're not fun. They're sore over a long time, and you have to make sure the fit is right. So you need trained in how to do it for yourself, and also how to help others. So you can't do that all in 2 hours. That needs time. And I am confident that the beginning of that supply chain is robust. And now